Hi, welcome to KidzDocTalk with Dr. Jennie. On today's episode, I talk to special guest Dr. Zulma Zorrilla Pabon from our Pediatric Associates Sunrise Office. She is known by her patients as Dr. ZZ. She's from Puerto Rico, where she attended medical school at San Juan Bautista School of Medicine and completed her residency in pediatrics at San Juan Hospital, Municipal de San Juan. She has been a doctor for 7 years with a passion in pediatrics. Dr. ZZ has worked in almost all areas of pediatrics, including ER, Hospitalist, Outpatient Pediatrician, and child abuse pediatrics. She has a special interest in helping teenagers and child abuse victims. In Dr. ZZ's free time, she enjoys gardening, embroidery, and playing with her dog Coco. She recently just got engaged and is looking forward to starting a family of her own. We have a really great conversation about all things teenage and adolescent health, and I hope you guys enjoy.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Hi, Dr. ZZ. Welcome. Thank you so much.
Thank you for having me.
I'm so excited to talk to you today. The last couple of episodes on the podcast have really focused on babies and younger kids and things that we see in toddlers. So I'm really excited to chat with you today about one of my favorite patient populations. And I know one of your favorite patient populations, which are teenagers and adolescents. So I know there's a lot to cover. So we're going to get started.
Perfect.
So one thing I want to start off with, because I think this probably comes up a lot, is tell us how it works when adolescents want to be seen without parental consent or just by themselves. Are we allowed to do that? And how would a teenager go about making an appointment like that?
So basically, before I start with confidential, I just want to let parents know there's 3 stages for our teenagers. And basically for us doctors, and what the American Academy of Pediatrics says is that teenager at early adolescence starts at 11. So you start having all the changes of teenagers at 11. So early teenager years, 11 through 13. The middle years are 14 to 17. And then we call late adolescents unto those that are 18 to 21, so basically the young adults. It comes to the point where sometimes the teenager is not comfortable talking with the parent about certain topics. So we want to tell all our population, all our teenagers, adolescents, young adults, that we doctors are there for them. If they have a question about anything and everything, we're there for them, and we're the perfect person that can answer anything about their bodies, or even, stress, even some frustrations, anything. But if they don't want the parent to know about their conversation, of course, any doctor can set us a time for you to talk to them, and they can answer anything. So yes, the American Academy of Pediatrics encourages us doctors, pediatricians, to give you confidential time. What does confidential time mean in this time is that whatever we can talk about, I don't necessarily have to talk to your parents about, unless it's something that can do with you causing harm to yourself, even being suicidal. Yes, there's some topics that we do have to discuss with parents. But if you want to talk about other topics, very controversial topics, sex, sexually transmitted disease, I want to get birth control protection, we can talk to you alone. And we can make it confidential. And in Pediatric Associate, we can do it a confidential visit, but we can control third parties, like insurance telling your parents that I did sexually transmitted diseases, testing. But yes, we can protect what your parent sees, and you can be comfortable in talking to us about anything you want.
I think that's really important. I think it's important for teenagers to feel comfortable coming to the pediatricians and to have those difficult conversations with them. I also want to point out that I think we are really good resources for helping teenagers navigate those conversations with parents, right? Like, we'll encourage the confidential visit, and we'll absolutely keep anything confidential that the teenager wants us to, but ultimately our goal is open communication with the family. So tell us about that. Have you been in those situations where you've had to have difficult discussions every day, right?
Every day it happens. maybe we're gonna I always go into the room and say, hey, you're a teenager, so I'm gonna do a lot of questions and I want to discuss them with you. Is it okay for mom or dad to be in the room? And if they're very comfortable, I actually congratulate them, because I do want them to have a really good relationship with their parents where they're open to discuss many topics. But of course, there's some that are shy or not comfortable enough to tell them the truth, and I can be that link. And at the end of the visit, I can be the one sitting down with both of them and having these conversations that are tough. Sometimes it doesn't have to do anything about, the topics about sex, but them feeling very stressed and feeling anxious or even depressed and feeling like they don't want to be a burden on the parents. So I'm that link to make them feel more comfortable into starting these conversations with parents. Or it could be either the other way around, where parents don't know how to talk to their teenager, and I'm still the link there. Like, we doctors are the link to sit down and be like, hey, your mother is worried about this area. You want to talk to me more about it? And then we'll bring in mom. Because it's very hard for parents. It's a very frustrating age. Parents think that they're still little kids, but they're not little kids anymore. They're teenagers becoming young adults, and they're becoming what they want to be in the future. They're becoming their future self, and they think differently, and they start maturing at certain levels. So we're their link, we're their help.
I think that's probably very validating for some people to hear, because it is a very challenging time to parent through. And you kind of think it's like the light at the end of the tunnel, because you're not dealing with a picky toddler or a school age kid who's struggling to adjust. But there's certainly unique challenges that come with this age. So I think it's important for parents to feel supported by what their pediatrician can bring to the table. So I actually think that's a good segue when we talk about checkups and well visits, right? When babies, you have to bring them in all the time, right? Toddlers, same thing, right? There's vaccines all the time, and they're growing, a lot of milestones. And then we hit that like 10, 11-year-old age that you mentioned. And there's not so much going on, at least on paper, that we need to have a pediatrician see us for. So what is the value of continuing to stay up to date on those checkups if kids are seemingly healthy?
Exactly. So that's what we're seeing. A lot of kids that age stop going to the pediatrician because they're not getting as sick. Also, they're not in daycare, their immune system is stronger, so they're not getting sick. But it's still important at least once a year to be seen. Why? Because we discuss everything. We discuss growth pattern, nutrition. We're going through a pandemic with everybody's indoors doing less exercise, so we have put on a lot of weight. We just discuss weight, we discuss nutrition, we discuss all the topics that I've just discussed. We discuss depression, sadness, make sure it's not too stressful, all the changes that are going around due to pandemic. We discuss sexuality, we discuss drugs, substance abuse, but the most important, we can get up to date with a lot of vaccines that maybe are not needed to go into school, but are highly recommended. And I can talk about a few of them if you would like. My favorite, and I'm gonna say it, I got it when I was a teenager. As soon as it came out, my best friend's mother is a pediatrician, so she got it for all of us, and it's the HPV vaccine. We're preventing cancer. It's the only vaccine that prevents cancer. And I know parents are gonna think, oh, but they're not there yet. No, you're protecting them for the future, because you don't know when they're gonna be sexually active and maybe you don't know about. And this is a virus that doesn't give you any symptoms until you probably have the side effects of the cancer. So, and you're thinking, oh, it's more for girls. Yes, it does cause cervical cancer, but we are protecting boys because of oral sex, we're seeing oral cancer happening, and it can go up to down to the vocal cords. So yes, they're recommending it, and it's available to us until we're 36 years old. So it's a very new vaccine, but highly recommended by the CDC and the American Academy of Pediatrics. Other vaccines are meningitis. Meningitis are bacteria that cause infection in the lining of the brain, and we can start protecting them because they're more common when they are in closed areas with a lot of persons, like, for example, in college, on dorms, but you're protecting them early, okay? Of course, we do give you the yearly flu vaccine, and we can discuss other vaccines. Like right now, I'm getting a lot of parents with questions about when can I get my teenager the COVID vaccine. And yes, there's already a vaccine that's for 16 years and older, and we can discuss what are the diagnoses the patient has to see if they are capable of getting the COVID-19 vaccine.
So I'm happy you mentioned the vaccines. I think it's important to hear that even though they're not mandated by school systems at that point, still super, super highly recommended and really critical for kids in this age. I just want to touch about one thing on the HPV vaccine, since you did mention it. I know we could probably have a whole conversation about it and the importance of it and the safety of it. But one pushback that I've gotten from patients myself when I offer it is either they'll tell me, oh, I know my child is not sexually active, so they don't need it. Or they feel like it's almost like a green light or a gateway for the child to become sexually active if they have access to this vaccine. So I know we have really strong studies saying that's not the case, but tell me a little bit about kind of having those conversations with parents who may be a little bit hesitant.
So basically, I know they're scared that if they're going to give them protection for something that is sexually transmitted, hey, so I'm protected, I'm going to have more sex. No, you have the early conversation, you have the conversation, and we have to start it earlier than 11. For example, an 8-year-old girl can get their periods. That's normal for them. So basically, you're protecting them because we don't know what can happen in the future and how early they can start having sex. But not only that, it's because when they become sexually active and they might be young adults already, you don't know if their partner has the HPV virus. So you're protecting them. It's because when you start them early at 11, it's only 2 doses if we do them before they're 12 years old. If it started afterwards, it's 3 doses. So you want to give this protection. It's like probably with the majority of the vaccines, for example, hepatitis B. That's also one of the sexually transmitted diseases because of body fluids and blood. Okay. And you're protecting them for their entire life. So it's not for when they're starting, oh, we're going to start and having sex and I'm protecting them against it. No, it's more protection. You want more protection for your child.
Thank you for that. I think that's really important. We could talk about vaccines all day long. I'm sure
it's
one of both of our favorite topics, but let's switch gears a little bit. And I want to talk about STDs. I think some people are surprised that pediatricians are so well versed and comfortable with STD screening and treatment, but we both know that we see quite a bit of STDs and we screen and treat for these all the time. So which ones do we actually screen for on a regular basis? And talk a little bit about your experience with patients who are positive for STDs and require treatment. Is it sort of an unusual circumstance or a little bit more common than we may think?
So I can actually give you, data of what we're seeing in Pediatric Associates. And from 2019 to 2020, we saw around 10,000 patients that were positive for either Chlamydia Gonorrhea or were coming over for screening of STDs. So that's a high number in 1 year. Yes, the most common ones we do diagnose is Chlamydian Gonorrhea, which are bacteria that can be treated, so they can have a cure, but they recur a lot. Mm-hmm. And the problem we're having is maybe that we're treating one patient, but that continues having sex with another person that still has the Chlamydia Gonorrhea and gets reinfected really fast. So the American Academy of Pediatrics does recommend that as soon as a teenager is sexually active, once a year get screened for STDs. Which ones? Chlamydia gonorrhea are the most common, but also syphilis. Syphilis is the other one that we yearly recommend screening, and HIV, because there's the risk always. Not every person that is sexually active is comfortable asking the other person for a condom. So we do recommend double protection, birth control if you're sexually active, and that double protection with condoms. But yes, Chlamydian gonorrhea keep being the number one that we're seeing. There's a new guidance from the CDC saying that we're treating very very resistant, drug-resistant gonorrhea now, and that goes in combination with chlamydia. So we have to keep checking them out, having these well checkups and these conversations, because it can get to the point where the infection can get very complicated, and then eventually then need an hospitalization to get them treated. So we just want to avoid that. So screening yearly, at least once a year for STDs is recommended in teenagers who are sexually active.
Excellent. I think really, really important, and maybe something that all teenagers are going to feel comfortable bringing up, or parents may not feel comfortable bringing up. I think a common fear is that they think it's an invasive test, right? That you need either a swab from the urethra or you need a pelvic exam to send these screens. And we know that's not the case, right?
No. So basically, we screen for Chlamydian Gonorrhea only in the urine. You just need a sample from the urine. Yes, HIV and syphilis screen is a blood, a blood lab work, but it's very easy, non-invasive. We do not have to do a pelvic exam. Not even for starting birth control, we need to do a pelvic exam. If there is lesions that the patient does want us to look, because yes, we still have other STDs like herpes active in young adults and teenagers that we can diagnose clinically. We don't even have to swab or test invasive ways.
Perfect. I think that's good. I think that's probably very reassuring for some people to hear. So since you brought up pregnancy and kind of pelvic testing, let's switch gears and talk about that. I know, unfortunately, we're seeing, a high percentage of our patient population getting pregnant, which may not necessarily be the intention. So let's talk about contraception and birth control. Not everybody necessarily wants to take a pill, right? They maybe have some resistance to having to take a daily medication or taking a hormone daily medication. What are options currently available for teenagers in terms of contraception that we can offer?
So yes, there's the American Academy and the CDC again are highly recommending what we call long-acting reversible contraception. So these are we pediatricians and Pediatric Associate right now are not giving them, but we do give you all the referrals necessary for you to get them. A adolescent pediatrician and a gynecologist can give them to you. One of them is the intrauterine device, and it's long acting because it can stay in your body 3, 5, 10 years and give you protection against pregnancy. It does not protect against sexually transmitted diseases, so that's why they continue to recommend double protection with condom. The other one is the implant. It usually goes in the arm and can be removed whenever the patient wants. And we also have the Depo Shot. It's a shot that goes in every 3 months, and this one we do have available in Pediatric Associate for the pediatrician who are comfortable prescribing contraceptives. Of course, my favorite one that it's easy to start is the oral contraceptive pill. You can start the same day it's prescribed if we're certain that the patient is not pregnant, and we start protection against pregnancy, because pregnancy is 100% preventable. And the American Academy does tell us we have to help them. We have to start those conversations that they're very shy in having. So we can prevent them from having the awkward situation where they have to think about an abortion or adoption or even becoming an early mother and all the consequences that entitles.
Definitely. Really, really important to bring up, I think, even with parents and having that conversation with their kids, so they're aware of kids' activities and intentions, even if they're not currently sexually active. So we mentioned pregnancy. Obviously, our goal for our patient population is always pregnancy avoidance. So when that's not the case, when a patient thinks that they might be pregnant, what is the next step? Because I think that maybe not so intuitive to call their pediatrician and talk about that. How often do we see that, and how do we approach those situations?
So again, I have data. In the last year, we've had around 800 patients that have been pregnant. So we do help them. These are high-risk pregnancies, so they do have to come to us as soon as possible. If you're thinking you're pregnant, come to us. We'll sit down. We'll do the testing available that is in every one of our offices, and it's usually not invasive either. It's just a urine, and we might need to make certain. We might take up the blood test, but we can give you more advice about what options does a teenager have when they're pregnant? We can also be the link on sitting down with your mother, parent, and having that conversation that you're pregnant or not. And we can do all the referrals necessary, get you in as soon as possible to an obstetrician, start you on prenatals, make sure your vaccines are up to date, and make sure your physical is up to date, because you might have chronic conditions that you're taking medication that are not suited for a pregnancy. So we can have definitely all those conversations with you in a confidential visit, or you can bring your parents, of course. So we're the link there to help you if you decide have a pregnancy, that it's a safe pregnancy.
What are some other risky behaviors that we're seeing in adolescents at this time, so parents can sort of have them on their radar to make sure that they're talking to their kids about?
So one of the most common risky behaviors is substance abuse, and the most common seen in teenager years is still alcohol. Alcohol is the number one. Of course, you have other drugs like marijuana, and there's also tobacco smoking, vaping, but still alcohol remains the number one. And we're in years that they start driving, and they have a lot of peer pressure into doing new stuff, trying out new stuff. So it's important for parents to be on the lookout, making sure how their teenager is behaving, acting, because that way you can pinpoint if they're starting any substance abuse. And always making sure, talking to your teenager, making sure they're not going through any stressors or depression, where they are more into being into having more risky behaviors with guns, with drugs, with alcohol while driving. And Florida is still right now a big one into human trafficking. So we're seeing a lot of teenagers taking and leaving houses and being on their own. And I've had them where they disappear for a few days, and that's a very risky behavior where somebody can just take them and they disappear. So it's very difficult to have a mom and being them in the office and saying, hey, they disappear for 2 days. I want you to check everything. And when you sit down with that teenager, the teenager tried alcohol, tried drugs, tried sex, and so parents do have to have this very tough conversations with them.
Definitely very challenging. And I think important for parents to be aware of all the potential situations and decisions that teenagers are kind of having thrown their way. So I know right now we're seeing a lot of impact on sort of this population and others with the pandemic and how it's affecting mental health and overall well-being. You mentioned one of the things that you're seeing a lot is like weight gain, right? So certainly I've seen all these growth charts for kids coming in for their well visits, and they're just like through the roof all of a sudden, right? Because everybody's been home and like not moving around. So
exercise.
Exactly. So that's been really tough. But I think another thing that we're seeing so much that's just been blowing me away is the amount of mental health dysfunction that we are seeing. And certainly I think pandemic is part of it, but this population has always been at risk for mental health challenges. So tell me a little bit about that. What should we be looking for in teenagers, and what are some things that we're seeing maybe a little bit more commonly now than before?
So basically, the first signs that a teenager might be going through an adjustment disorder due to pandemic with more anxiety and depression is they're overeating. They're overeating. That's one sign there. There's anxiety. And another one is sleeping. Sleeping patterns change. They're not sleeping too much, or they're sleeping too much. They don't want to socialize. They start doing their hobbies. What they used to like, they're not doing it anymore. So that starts becoming warning signs that something might be wrong. They're very angry. They're becoming very angry, aggressive. They used to have a lot of friends. They're not talking to any of their friends. Teenagers are usually very, very social. So when they stop becoming very social, they don't want to interact with anybody. They're in their room 24/7, not eating correctly or eating at different hours of the day. they become night people, start having that conversation with them. What's going on? How is school? School has become a big stressor right now in pandemic. They're getting a lot of homework, a lot of work, and some of them are very overwhelmed. It might be that they are good with their body image, they're eating correctly, but still they have a lot of stress coming their way from school. So I get a lot of questions is, should I be sending my teenager back to school? And I tell them, hey, if the grades are suffering, if he's not able to concentrate, long hours staring at a computer, yes, that might be one of the times that, yes, you could send them, because they need it. They need the social interaction. They need to spend time with friends. They need to get outside of their rooms, because they start just locking themselves up in their rooms or in the bathroom for long hours. And that can be warning signs that they are going through more stress than usual.
That makes sense. That makes sense. So definitely something I think we're all seeing and important to be aware of. So I think at this point, like any parent listening is probably like, oh gosh, there's so much to think about, right? There's sex and alcohol and mental health and grades and weight, and it's totally overwhelming. So what are some like concrete things? What are things that parents can do to really make sure kids are doing well, to have open lines of communication with their adolescent, to make sure that things are well adjusted? What are things that parents can actually do to take into their own hands?
So basically, I do advise first, you can read about how to sit down and talk to your teenager. The American Academy of Pediatrics has a website, it's called healthychildrens.org. And we in Pediatric Associates, under resources, there's a teen area where you can get more resources on how to sit down and have these tough conversations. Starting in early teenager years, where we have to sit down and we're seeing that the teenager is growing, is going through different stages of changes in their body. That's when you start having these tough conversations on why you're going to get your period, or why is your body changing and you're having odor and you're having hair where you weren't having hair before, and you're going through this different stages of thinking and angers. There's more resources for you to sit down and read, but then have that conversation. Sitting down with them is what they usually need, and go over, hey, so how is school? Have that conversation of dating, of sex, of substances that are available and they can see and they can be offered. Have that conversation about safety, violence that can happen around them. So it's basically sitting down, but there's always resources. And if you always have more questions, you can come to any of us pediatrician and we can give you more details on how to start that conversation.
For sure. I think really, really important to feel comfortable talking to your teenagers, and more importantly for your teenagers to feel comfortable talking to you as a parent. So really, really good. Great concrete advice. As we wrap up, anything else, anything that you feel is really important to mention when we talk about healthy teenagers, or anything that a message that you kind of want parents to take away?
So basically, I know due to pandemic, we've been caught up inside our homes. And one thing that teenagers do a lot is that they're on their phones.
Mm-hmm.
Get quality time, put aside the phones, put aside the screens, get out, go to a park, have fun. We need to start having fun again, safely, of course, and keeping our mask on and 6 feet apart. But there's still things that they needed. They need the time out of their house, out of the computer. Screens can get them a little bit depressed because they're comparing themselves to whatever they're seeing. So do take the time to spend time with your family and go out and have fun. It can be in a park, it can be a walk every day. Having 30 minutes to walk around the neighborhood, it might be enough to help them go through all the changes they're going through.
Fantastic. That's a great takeaway. Thank you so much. Thanks for the time that you took to speak to me today, and appreciate all of your insight.
Thank you. Thank you, Dr. Jennie.
Don't forget, we are running an Instagram giveaway. Head over to our Instagram page at Ped Associates for more information. You may win a chance to be featured here on KidzDocTalk, as well as an Apple iTunes gift card. Contest ends April 30th.